Well, NeoGraft is really a trade name or a brand name for a device that is used to harvest the grafts. And you know, hair grafting, I've been involved with hair grafting since 1987, and one of the lead hair grafting pioneers is really from Brazil. And NeoGraft itself, that machine emanates from France, but it really involves a very unique way of harvesting small little hair grafts without leaving scars, which is really nice and really different from what's been done in the past. And the process then goes on to place these grafts in parts of the head that have lost hair without leaving that cornrow or kind of planted forest appearance. So it's a very natural appearance. The nice thing about it is it's done under a straight local anesthetic. Patients really have little to no discomfort, little to no downtime, with very, very natural results. One of the, I think one of the real benefits, though, to neografting is that there are no scars. The other thing that is, I think, might be surprising to many people is that 30 million women suffer from female pattern hair loss or thinning, and we have done a number of women with this technique, and they are particularly good candidates because they usually have quite a bit of hair in the back of their head, which is the donor site, and they can be back to work within a matter of 3 to 4 or 5 days without anybody knowing they've had anything done. Obviously a great number of men benefit from this procedure as well, and that's what we all think about when we think about hair transplantation or restoration. But the number of women that suffer with this problem is many more than you would typically expect. The nice thing about the NeoGraft procedure is we can get up to 2,000 or so grafts at one time, which often is all that someone will need. If someone doesn't want to have it all done at one time, they have the option of doing it over a period of a year or so, having 2 or 3 separate sessions. So it is possible to do everything at once. It's also possible to stage it, and that's one of the things we would talk to an individual about when they come in to see us. Now, I would say that the procedure can all be done at once, but hair takes time to grow, and once it's planted in its new site, it does take about 12 weeks for the hair to begin to grow. And so to see that full head of hair, which is what patients want to see, it can take up to 6 months. There are a number of things that people should do in preparation for the NeoGraft procedure, but none are particularly time-consuming. And we do treat it as a surgical procedure, although I would emphasize it's a minor surgical procedure, and there are certain things that we would like them to avoid, such as aspirin or blood thinning products. And then we have a typical night before preparation that we put them through. But there's not a lot of preparation that's necessary for this procedure. A good candidate for a NeoGraft procedure would be a man or a woman that has developed some male or female pattern baldness. They can't have a sort of a systemic or total thinning of the hair. There might be a medical issue that is causing that, and certainly that patient has to have the medical issue addressed before one would consider NeoGraft. So it is somebody with the typical male-female pattern baldness without any underlying medical or systemic causes for that baldness. Well, one of the things that we do is, this is a medical procedure. We're a medical office, and a good history and physical is carried out in every single patient that is planning to have this procedure. And if there are any warning signs that there may be a medical issue going on, such as hypothyroidism or something else, then we would all direct them through their primary care physician to the right specialist to work on those issues. Well, patients, surprisingly, they are as happy with the whole process as they are with the results. So they enjoy actually the procedure. The procedure is not painful. I've been surprised by this, and we have a team that kind of descends upon them and gets this done relatively quickly, taking about a morning to do it. And we typically serve them lunch, and they go home. And the response from that process is overwhelmingly favorable. And then the results, which appear, as I said, 12 weeks or so later, the results are beginning to appear. You know, it's just been a great experience.